Today we will be discussing about healthy lifestyles and its importance in maintaining our mental health along with physical health. Now before we go straight to these factors, let's first understand what health is and what is healthy lifestyle, and moreover why is it important to maintain these healthy patterns in our life. So if we come to the definition of health, in 1948, World Health Organization defined health as a complete state of physical, mental and social well-being, and not merely the absence of disease or infirmity. This definition is at the core of health psychologists' conception of health, because rather than defining health as an absence of illness, health here is recognized to be an achievement involving balance among physical, mental and social well-being. Many use the term wellness to refer to this optimum state of health. Now, there is a term also we know, that is the biopsychosocial model of health. And what that says, this is the idea that the mind and body together determine health and illness, logically implies a model for studying this biopsychosocial model. This model is called biopsychosocial. Why? Because it maintains that health and illness are caused by multiple factors and produce multiple effects. This model further maintains that the mind and body cannot be distinguished in matters of health and illness, because both so clearly influence an individual's state of health. This model emphasizes both health and illness rather than regarding illness as a deviation from same steady state. From this viewpoint, health becomes something that one achieves through attention to biological, psychological and social needs rather than something that is taken for granted. Now we are coming to the healthy lifestyle. Now, what do you understand by the word lifestyle? Lifestyle is typically the conventional daily activities which are accepted by people during their lives, and these activities can affect the health of the individuals. By selecting a lifestyle, an individual tries to maintain and promote his or her health and avoid disease through having some set of activities, any healthy activities for immunizing their body, for their better living, for promoting healthy lifestyle. However, many times this healthy lifestyle is confused with healthy behavior and health promotions. But this healthy behavior and health promotions are different from healthy lifestyle. What is health behavior? A health habit is a health related behavior. Any healthy habit is a health related behavior that is firmly established and often performed automatically without awareness. That means the healthy behaviors are not enforced. We do it automatically. These habits usually develop in childhood and begin to stabilize around our teens. However, this healthy habit may be developed initially, but it might be reinforced by the specific positive outcomes such as parental approval and maintained by various environmental factors which is customarily associated. And what is health promotion? Health promotion is a general philosophy that has at its core the idea that good health or wellness is a personal and collective achievement. For the individual, it involves developing a program of good health habits early in life and carrying them through adulthood and old age. For the medical practitioners, health promotion involves teaching people how best to achieve this healthy lifestyles and helping people at risk for particular health problems, or learn behaviors to offset or monitor those risks. And for the psychologists, health promotion involves the development of interventions to help people practice healthy behaviors and change poor ones. For the community and the national policymakers, health promotion involves a general emphasis on good health, the availability of information to help people develop and maintain healthy lifestyles. So, health promotion is a philosophy of life, how to lead a good life, a healthy life. Now, we are coming to the factors that are needed for the health promotions or the behaviors that we should uptake for maintaining a healthy lifestyle. Now, for the health psychologists, they have singled out various factors, and we will be discussing it one by one, starting with physical exercise. Health psychologists have examined the role of exercise in maintaining mental and physical health. Any exercise stimulates and strengthens the heart and lungs, improving the body's utilization of oxygen. Physical exercise is an ideal way to lower one's stress level and perk up their moods. Researchers have found that exercise is associated with short-term mood benefits and stress reduction. Exercises marked by its high intensity, long duration, or any other kind of exercises are found to be effective in health promotions. Among the forms of exercise that meet this criteria of endurance, intensity and duration are jogging, bicycling, rope jumping, running, aerobics, swimming, etc., etc., etc. However, other forms of exercises are also there, like the weightlifting or the sprinting. Any kind of exercise is good for the health and for the overall fitness, because they draw on short-term stores of glycogen rather than on the long-term conversion systems associated with the exercises like aerobics. So, whatever form of exercise has got a good effect on the overall health. Health benefits of exercise are substantial, and it has been found to decrease the risk of chronic diseases, including heart disease and some types of cancers, including breast cancers. Now, let us see some of the health benefits of regular exercise, be it freehand or high endurance or high intensity. These are increased oxygen consumption, decrease in resting heart rate, decrease in blood pressure, increase in strength and efficiency of the heart, decrease use of energy sources such as glutamine, increase in slow wave sleep, increase in the HDL, decreases in cardiovascular disease, decrease in obesity, increase longevity, decreases menstrual cycle length, decreases estrogen and progesterone, decrease risk of some cancers, increases immune system function, and decrease negative mood. So, other than this negative mood, various psychological researchers have shown that exercise has a good effect on the psychological states such as mood, anxiety, depression, and tension. And it has been found to have a very beneficial role on both mental and physical health. Regular exercise improves mood and feelings of well-being immediately after the workout, generally because of the hormone endorphin that is released by doing any kind of exercises. Now, Along with this high intensity or endurance exercises, there is another kind of exercise that is a very important, but in it is a kind of different type of exercise, we can say, that is yoga or meditations. This has got a very good effect on the mental health. Some we can discuss is like it decreases regular practice of yoga or meditation. It decreases stress. It relieves from anxiety. Studies have found that people with post-traumatic stress disorder is often have found recluse relief from the anxiety that they experience by practicing this meditation and yoga. It also improves heart health. It fights depression, can reduce chronic pain, and promote sleep quality. Actually, by doing yoga, one can also improve the breathing. That is, we all know about pranayam, a yogic breathing. This is a practice that focuses on controlling the breath, and by doing this breathing techniques, actually the amount of oxygen flow in the body, it gets balanced. Now, another important factor of healthy habit and healthy lifestyle that works hand in hand with exercise is having a good diet. That is, good nutrition. Developing and maintaining a healthy diet actually should be a goal for everyone, and this is an important and controllable risk factor for many of the leading causes of death and contributes substantially to risk factors for diseases as well. So, dietary change is often critical for people at risk who have been diagnosed with chronic diseases, but this is a very important factor as its implications have been found in a broad array of diseases. So, poor nutrition can impair our health and well-being and reduce our ability to lead an enjoyable and active life. In short term, poor nutrition can contribute to stress, tiredness, and the capacity to work. And in a longer tenure, it can contribute to risk of developing some illnesses and some health problems like obesity, hypertension, cholesterol, and heart diseases, then diabetes, cancer. Diseases like this can be due to poor nutritional intake. For healthy eating, the food pyramid is an ideal guideline. This is a representation of the optimal number of servings to be eaten each day from each of the basic food groups. This is also called healthy eating pyramid or eating right pyramid. Therefore, maintaining a proper diet contributes to positive mental health along with physical health. Dietary modifications by experts are recommended in this regards. However, many efforts to modify diet are done on an individual basis in response to a specific health problem or health risk. Physicians, nurses, or dietitians or other experts in this work, they basically try to modify diet responsive risks such as obesity, diabetes, coronary heart disease, or hypertension. Any effort to change diet needs to begin with education and self-monitoring training because many people have a poor idea of the importance of a particular nutrient and how much of them their diet actually includes. Dietary interventions involving reductions in cholesterols, fats, calories, and additives and increases in fiber, fruits, and vegetables are widely recommended. Yet, long-term adherence to such diets is low for many reasons. because most of these diets or the recommended ones are found to be tasteless, or that is because of some dietary behaviors that are hard to change, and the attitude of the clients may not be in favor of this dietary change. So there are actually many reasons for which this dietary change or dietary interventions sometimes fail to improve or maintain a healthy behavior or become a healthy behavior. And here actually comes the importance of the family intervention, because whenever a doctor or a dietitian is devising a customized diet plan for a member of the family, it might be that the client does not find it tasty, or they find it uncomfortable to feel because they are served a different kind of food that they are used to have at home. And when the other members are having the same the old diet, the same type of diet that they were having, then that actually offers a risk. In this type of situation, there is a family interventions where the family members typically meet with the dietary counselor to discuss the need to change the total family diet, so that the family members then talk through the specific changes they might make. Sometimes a family attempting to make these changes will get together with other families who have done the same thing in order to share the suggestions and problems that they have come up with in their efforts to modify the family's diet. So, as all the members take part in the healthy eating, the diet seems to be more persistent than the modification of a single person's diet. Now, there can be community interventions also in this case, and that is the interventions that have been implemented on the community level, where the education campaigns are mounted in supermarkets, or some computerized or interactive nutritional information system is placed in the supermarkets or in the vehicles we are traveling. That is generally done by the government order. So that can also be implemented to improve a healthy lifestyle in people. Next point is safety. Whenever we see this word or we say this word, the concept of accident prevention comes to our mind. But what are these accidents that we need to prevent for the proper mental health? Well, in English dictionary, accident basically refers to any unfortunate incident that happens unexpectedly and unintentionally, typically resulting in damage and injury. Now, this damage that is mentioned over here not just mean a physical one, it means an emotional setback too. So the concept of safety in health psychology covers all the topics from road or occupational accidents to teenage pregnancy. Now let's start with the most obvious ones, that is the accidents at home, workplace or on road. Now accidents in home such as the accidental falls or accidental poisoning can be prevented by actually having a good parenting system. Many of the times the parents undertake various injury prevention activities for the safety of their children, generally below 5. Then if we are coming to the occupational accidents, they are resulting impact on disability or particular health risk for the people are quite high. And consequently, strategies to reduce accidents have increasingly been a focus of the health psychological research teams, and they have given various interventions for controlling those. Now we are coming to the motorcycle or the automobile accidents, that is the road accidents. Now, the single greatest cause of the accidental death is due to the motorcycle and the automobile accidents, and various psychological researches done on this found an interesting fact that the factors associated with the accidents include the way people drive, the speed at which they drive, the use of the preventive measures rather than the road conditions. So, it is clear now why these safety measures such as reducing highway driving speed to 55 miles or use of seat belts or placing the child in the safety restraint seats have been in vogue for quite some time as under the traffic rules. Now, substance abuse is another major concern. That is, smoking, drinking, or any kind of drug addiction produce a range of short and long-term side effects that are detrimental not only to physical but mental health also. Like effects of smoking include gum disease, oral cancer, loss of taste, mouth sores, bad breath, then in some cases risk of cancer, skin cancer, fungal nail infection, damage to some tissues, or getting wrinkles in the skin. Then consumption of alcohol also creates havoc in people's life, like it interferes with the brain's communication pathways and can affect the way the brain looks or works. These disruption can change mood and behavior of the people. It can also cause cardiomyopathy, stroke, or high blood pressure. In some cases, it can lead to fatty liver, alcoholic hepatitis, fibrosis, cirrhosis of liver, and cancer. Smoking, drinking, or any kind of drug addiction is very bad for the pregnant ladies also, because that does not only risk the mother but also the unborn fetus. Well, talking about safety, the last point to discuss is unsafe sexual relationship. Now, sex life is a normal, healthy part of life, but it can be risky if someone do certain things that could spread disease or cause physical or emotional harm. Things that should be avoided to have this sexual relationship in a protected way is to avoid unprotected sex. And what does this mean? This means having vaginal or anal sex without a condom. It makes both the partners more likely to get HIV and other sexually transmitted diseases. Body fluids like blood and semen pass from one to another during sex. If one partner have HIV or any other STD, even if they do not know it, it may pass the virus or the infection to the other partner. To lower the risks, it is always advisable to use a condom. Then there is a case of multiple sex partner, where one has more than one sex partner or many sex partner during one's lifetime. So to lower this risk, it is a good idea to get tested for STDs together and share the result with one another. Another thing is an anal sex. It is why? Because the lining of the anus is much thinner than the vagina, so it can be damaged much more easily. That makes it much more vulnerable to infections. Another thing is sex and drugs. Now, actually, we don't get HIV or any other diseases, including hepatitis, also through only sexual contact. You can also get them from someone who injects drugs. So, if the person you are having sex with shares a drug equipment with someone who is HIV positive, he can contact that virus through that needle or water bottle caps. Spoons or even cotton filters can expose him to someone else's HIV injected blood. So, the best way to lower this risk is to get away from drugs. Another risk or a safety to maintain is that of oral sex. Now, oral sex is sometimes referred to as the oral intercourse, is a sexual activity involving the stimulation of the mouth, including the lips, tongue or teeth or throat. So, any infections like human papillomavirus, gonorrhea, herpes or hepatitis and other sexual transmitted diseases can be transmitted through oral sex. The best way to reduce the risk of oral sex is to abstain from it, that is, not having oral sex, or by using a protection, that is, please have a check if the partner is having an STI or has some sores, cuts, ulcers, blisters or rashes around their genitals, anals or mouth. Another thing is, if we maintain all this, we can obviously lower the risk of unwanted or teenage pregnancy, and that is a very important advantage of having a safe sex, because teenage pregnancy or unwanted pregnancies have a massive emotional turmoil for the girl undergoing the thing or experiencing the thing. Now, another safety measure that can be used to safeguard the mental health is to avoid this social media addiction also. Now, actually, any addiction is potentially harmful if it saps one's energy away from other activities, such as work, physical activity, or any relationships, anything. Social medias, however, are neutral, but it can cause stress and other negative emotions, like in cases of the cyberbullying or the people who are attached to trolling or arguing about everything from politics to sports. If interacting on social media causes stress, it's obviously not good for anyone's health. Now, some of the effects that social media have on the physical side is like it can give to carpal tunnel syndrome, and this is a thing in which the person may experience problem that affect hands and wrists. There are also specific problems associated with keying the mobile phones and can strain the tendons of the fingers. Well, it can also give rise to eye problem for gluing to the screens for too long. Another thing is fatigue, that is, if someone is being awake all night on the social media, so it can give sleep deprivation. It can also give you a lack of exercise and may cause distractions from various other important events of your life. So, by maintaining all these factors, we can have a good health, we can promote healthy behaviors, and have examples set for the younger ones to maintain a healthy lifestyle, and eventually we can have a long life also. So with this, we have completed this topic of health enhancing behavior patterns. So if you have any doubts regarding this, please reach out to me. Thank you, class.